When it comes to health and wellness advice, it's easy to get overwhelmed by too much information. Especially if the topic is kind of embarrassing. But your body is your body, and your life is your life. No need to be embarrassed. Torri here, equipped with information from the Cleveland Clinic to answer your sometimes squicky, sometimes scary medical questions. This is the TMI Show. So go ahead and ring that bell because I expect a lot of TMI questions, and you're gonna wanna know the answers. Odd funguses, swallow something weird, did an object accidentally get stuck in an orifice? Or are you just overwhelmed by all the competing information on vaccines floating around your Facebook feed? Make sure to leave comments about any and every topic you want us to cover. Trust me, there's no way you can gross us out. Two very common mental health issues in America are anxiety and depression. Doctors sometimes talk about them together, depression and anxiety. But what is the difference between the two? How can you tell if you're experiencing one or the other, or both?
I'm so damn confused.
Depression can be a little tricky to recognize because depressed people can actually appear to be agitated, just like people with anxiety. So no, depressed people aren't always human representations of your
I was bound.
In fact, depression can cause some people to be overly sleepy and others to be super restless and unable to sleep. And the other confusing thing is that an estimated 30 to 70% of people with depression have anxiety too. To be diagnosed with depression, you have to experience extreme sadness or loss of interest in the things you love. Other symptoms include difficulty concentrating, deep feelings of worthlessness or excessive guilt, appetite changes, and loss of energy. Feeling sad sometimes is totally normal. Not everyone can be JoJo Siwa. Her power's in her ponytail and her bow. You may be upset about a specific event, think breakup or workplace issues, but with some time or the ability to process the issue, you're able to move ahead. That's not the case with depression. Depression interferes significantly with your ability to function in the day-to-day world. If your home, work, or social life are negatively affected, you might be dealing with major depression, rather than a typical case of the blues. But hey, this is the TMI Show. A lot of us feel uncomfortable talking about these symptoms.
Don't talk to me about life.
And sometimes well-meaning friends and family don't fully understand. Maybe you've heard it or even said it. Just get out of bed. Just pull yourself together.
Can you just get up yourself?
Or the super annoying, smile. I hate that. Please stop. For a person experiencing a true depression, they would if they could, but they just can't. And that's okay. Major depression is a common illness and affects about 16 million American adults. The earlier treatment is started, the more effective it is. Antidepressant medication, psychotherapy, or a combination of both are standard treatments for depression. If you're experiencing symptoms, it's important to talk to someone. You don't have to go to a psychiatrist or psychologist for help. Talk to your regular doctor or even your OBGYN.
Hi, I'm sorry. I got this number under fertility in the Writers Guild Health Manual.
I'm also listed under child psychiatry.
And if you don't have one, remember, no shame here, just real talk. There are helplines you can call. If you feel out of control or suicidal, you can always go to your closest ER. If you're prescribed antidepressants, don't quit taking them if you don't think they're working right away. Taking any kind of medication can be frustrating, and antidepressant therapy can take up to a couple of months or longer before becoming fully effective. Now, this is where it's really important to talk to your doctor. They may increase the dose, prescribe another antidepressant, or try drugs sometimes used to treat other conditions, like anti-anxiety medications. So yep, anxiety can be a symptom of depression, and anti-anxiety meds are sometimes used to treat depression, but they're two different things. Anxiety and depression are both normal human emotions.
Okay.
And like depression, anxiety can also be a serious illness. Symptoms of anxiety include feeling keyed up or restless, irritability, and of course, excessive worry. People with anxiety have trouble remaining in the moment because their fears are always about something in the future. They're always thinking about the what ifs. What if I forgot to turn off the stove? What if my house is already burned down? What if the pile of ashes that used to be my home blows away?
This is fine.
Excessive what-if thinking means people with anxiety can't enjoy the present moment. Other symptoms are intense feelings of panic, muscle tension, uncontrollable obsessive thoughts, flashbacks to traumatic experiences, nightmares, and heart palpitations. Anxiety can sometimes lead to a full-blown panic attack. Panic attacks can escalate over seconds to minutes and be extremely physically intense experiences. Your heart is beating fast, you can't get your breath, you feel like you might die, and then it goes away. Not unlike a bad relationship with someone named Chad. For some people, this may happen only once or twice in their lives. It's extremely unpleasant, but not necessarily a sign of an anxiety disorder. That said, if this happens on a regular basis, you should seek help. Therapy and medication could be part of the prescription for an anxiety disorder, plus cutting out things like caffeine and alcohol. Great. And trying things like meditation, exercise, and healthy eating may help. So let's quickly recap. Depression typically looks more like sadness, emptiness, or lethargy. Anxiety looks like dread, muscle and body tension, and difficulty remaining still or calm. Now, these are tough issues, but depression and anxiety are treatable, so there is hope. Some situations will respond to self-help techniques, others to therapy, and still others will require meds and therapy. But most people with depression and anxiety will be able to live the lives they deserve, the lives we all deserve. And you deserve a round of applause for taking the time to learn about these TMI topics. If you'd like to talk to me about a TMI question, feel free to ask in the comments. Dear Torri, my fungus is mushrooming out of control. Oh, okay. Thanks for watching, and don't forget to drink water. Yeah!